Uh, Welcome to SDP Connect. My name is Christiana Morales, and I am the Director of Self-Determination Program here at Disability Voices United. We have a really interesting discussion to talk about today. We're going to talk about the master plan. The very first meeting happened today. But before we get started, I'm going to talk a little bit about a couple announcements that we have. And I'm going to share my screen. And the first one we have is we are doing, I realize this is in Spanish because we are doing for RCOC, their local volunteer advisory committee, we are doing a 3-part training all in Spanish for person-centered planning. And it's going to be April 20th, May 18th, and June 15th. Those are all Saturdays. They're on Zoom. And we will have Spanish to English interpretation if you would like to hear it. But this is for our Spanish-speaking community. We want to make sure that you have this great opportunity to go and learn about person-centered planning. We'll put the link in the chat for you. Our next announcement is the North LA Volunteer Advisory Committee is hosting a training on the financial management service models. That's going to be me training. So if you want to come see me, join us April 17th on Zoom. It's from 4:30 to 6. We're going to be talking about how you figure out which is the right model for you. We'll go into the ins and outs of all the different ones. And we even have a kind of a checklist to help you pick your correct model. That link will also be in the chat. So I'm going to stop sharing my screen. As I said, today was the first meeting for the master plan. I'm going to put the link for the master plan into the chat in case you want to go look up what it is and what's going on with it. The idea of the master plan is this is the Newsom administration last year had a plan for it was aging, wasn't it, Judy? It was on health services and aging. And this year, their focus is on developmental services, all close to our hearts here. And so we actually have 3 of our staff members are on the master plan committee. Tim, who is over there raising his hand, Judy Mark, our president, and Elena Tiffany, our SDP assistant. We also have a lot of friends of Disability Voices United on the committee. And so we thought it'd be great to have them come and talk about what happened at the meeting today and just kind of comments about it and get comments from the community. So welcome, Judy, Elena, Tim. Tina was also there in the audience. And so she's going to bring her insight into it. I was also there in the audience, and I believe, is Kavita here yet? She may not be here yet when she gets here.
It's not, but Keisha Weller is, who sits on the master plan. So if we could make her a co-host, and that way she can chime in whenever she wants.
Awesome. So who wants to go first to talk about, first, it was a very long day. We know this. So, so if any of them nod off during the conversation, you'll know why.
Yeah. And Jessica is saying something I was just about to say in the chat, which is that the public comment is still going on for the master plan meeting. So we're kind of like taking people away from from actually commenting on master plan and coming onto this meeting. So if folks aren't here because they're still waiting to make their public comment, we totally, completely understand. So first of all, yes, we are really, really tired because we got up very early. Tim can tell you the story of how he made it to Sacramento with the help of the fire department. But this was the very first meeting of the master plan. The master plan stakeholder committee. So there's 36 people who are appointed. They are supposed to be representing the diversity of the state. And I would say that they're not, it doesn't really reflect it. We have, it is definitely underrepresented with Latinos, because Latinos make up about 42% of the state of California, and they make up about 17% of the master plan committee, and that includes Latinos who are not self-advocates and family members. That includes Latinos who are FMS providers or other kinds of people. So, clearly there needs to be more representation, but I don't think they're going to change the makeup of the meeting of the committee at this point. What they are going to do, though, is they are going to go out in the community and they're going to meet with a whole range of different folks. If you represent a specific community that you think it would be good to host sort of either a focus group or a community meeting about your vision for the developmental services system, I urge you to get in touch with them or get in touch with me and I can be your conduit to them. I definitely want to have the people who are part of the self-determination program in multiple areas be part of this this process as well. So I'll just do a quick overview of what they did today, and you can see actually that they had an agenda. At least for Elena and me, it was very touchy-feely today. It was a little too touchy-feely. We got to know each other. We got to talk a lot about vision, which is not a bad thing. And I think for some people, they really appreciate that kind of stuff. I'm like ready to get down and dirty and let's get some work done. So we started after introductions. We started with what is sort of how do we envision the system? Like if you closed your eyes and kind of envisioned it, what would it be like? And it was kind of all over the place. So on this master plan are people coming from very different perspectives. Regional center executive directors and ARCA are on it. Many service providers, advocates, from advocacy organizations. And then, of course, there's self-advocates and family members. There are also self-advocates and family members who don't just represent self-advocates and family members, but they're also service providers. And so service providers are, sometimes when they speak about their perspective, it is from the perspective of the service provider, even though they may also be a family member. So I think it's important as you are involved in the master plan and as you're hearing what people are saying, it's like what is their what is their perspective? Where are they coming from? I wish that on the master plan website it would tell the title and who the people are on the master plan committee, because all it had is a bunch of names. Honestly, there were people there today that I didn't even know who they were and what their relationship was to developmental disabilities. So it would be great for me to know that. So there was, we had sort of these vision statements, and then we also talked a bit about priorities. And that to me, honestly, I didn't understand the difference between priorities and visions. And sometimes it was people's priorities were in incredible excruciating detail, and in others it was like really broad statements. And then after that, we kind of went into public comment, of which there were probably about 100 people who wanted to give public comment. So I think that folks will be leaving the master plan pretty soon. I would guess they're getting through those comments. So that's kind of a general overview. Elena, Tim, Keisha, anybody else want to add anything? Elena, what'd you think? You able to unmute, Elena?
She says her internet connection is unstable. Give her a minute.
Okay. All right, no problem. We're seeing you just fine, by the way. Keisha, can you turn on your camera by chance? Is Keisha a co-host? Okay, she should be. Okay. Where did Keisha go? Oh, she's still here, but she's not. Can someone make
Thank you.
Co-host, please? Keisha Weller, co-host. Can you make it? Okay, very good.
Thank you so much.
Here you go.
Thank you. The master plan committee,
I agree with Judy that the visiting that we were doing and also the priorities, I don't see much difference in that. But we were broken up in small groups to do the activities. And it was difficult because in a small group setting, none of the advocates had their facilitators with them, and I was having a difficult time without my facilitator being in the room with me, and so that's difficult. But I do like how we got to do the visiting statements and in the priorities, but I just like Judy, I really want to get down and dirty. I really want to get to the work of the master plan committee, and this and I would also like everybody to have their names on Zoom and what position they have, so that we could identify them. You know what I mean, guys? I think that's pretty much my input right now.
Thanks, Keisha. Tim?
There were a lot of professionals in the master plan meeting. I thought that self-advocates didn't really represent it well. By self-advocates, you want to hear the overall perspective from the IDD community, but I felt it was like a postal message of their agency.
Yeah, there weren't enough self-advocates in the room, that's for sure, and they didn't speak enough, but hopefully, does anybody else sort of, Christiana, we're just so tired that we're like having problems putting words together. Maybe Tina, do you want to talk a little bit about what it was like in the audience?
Oh, the audience was really, really frustrating because they had it in webinar mode. So like we couldn't use the chat. We couldn't really take part very well. We could only like talk to each other, but we couldn't even like do that very well because it's not like the chat here on Zoom where you can reply to someone and your response might come out 5 people down, and so it's not got connectivity. A lot of people there were a lot of self-advocates that were there wanting to give their, their feedback, and a lot of really frustrated people. I hope that they read the question and answer section because a lot of people put really detailed information in there. And I think it would be very beneficial if they actually go through and read those things. It bothered me that they didn't talk much about self-determination at all in this whole master plan meeting. They didn't even, I mean, even the people that were speaking, I never heard anyone's identified as having being in the self-determination program. So that makes me feel like we're underrepresented. And yeah, it was really pretty frustrating.
Yeah,
I put it in the chat like frequently. I mean, I put several things in the, well, it's not the chat, but the question and answer thing. I brought up self-determination several times because I didn't understand why they weren't talking about it.
yeah. Yeah, it is interesting. Actually, the self-determination program is very overrepresented in the master plan committee. Since we are only 1% of the 400,000 people served in the system, and yet on the master plan, there is, obviously, myself and Tim and Elena, we're all in self-determination. And then there's Kelly Colza-Reyes, who's in self-determination. There's Victor Lira, who is in FMS. Who am I missing? I feel like there's even more than that in the SDP.
They just didn't, like, when they were announcing people or
Yeah.
introducing people, and they didn't
Yeah.
say at any time. And even in the question and answer, like I asked, is this guy Eric in self-determination? Because Like he sounded like he might be, but like there's no way to know because they didn't actually say. But the thing that was most frustrating is people were asking questions and giving feedback and being ignored because like I even asked them like if I wanted to be on the master plan, what do I do and how do I do that? And they just ignored me. They never answered me even when I like repeated my question because yeah, a lot of people were really frustrated.
Yeah. If anybody, I would love to get a copy of the chat. I don't know if anybody downloaded the chat, or I know you would have to had to download the Q&A. Maybe that's why they do it through the Q&A, because so that we can't download it. Oh, so somebody just wants to know what this master plan is. So the master plan is a process that's being led by the Health and Human Services Agency. So that's the agency that's above uh, the Department of Developmental Services. It's also above Medi-Cal. And if someone could respond, okay, Kavita's trying to get in, but she says it's a webinar. She might be on the wrong, she may be in the wrong meeting. Is Kavita here? Sorry, because oh no, she's not. She's in the wrong meeting. I'm just going to text Kavita because I know she wanted to speak. Okay, so so the way that the way that it really has to the way that we need to move forward is to ensure that that everybody, whenever they introduce themselves, whenever they talk about the self-determination program, because I believe that a lot of the issues that are being raised and a lot of the visions that people have will get solved by the self-determination program. And or at least if it's not completely solved, it'll move towards that that role. You should know that the very beginning of the meeting was a greeting by Secretary Mark Galley, the Secretary of Health and Human Services. And he talked a lot about equity being the major piece that we need to look at in the DD system. And he also talked about all the systems, breaking down the silos between the Department of Developmental Services, the Department of Healthcare Services, which is Medi-Cal, the Department of Rehabilitation, the Department of Social Services, which is IHSS, that and a lot of people talked about this concept called no wrong door or one door. And so what that means is instead of us going to the regional center and saying, you know, we need supports in our home, and the regional center say, well, you got to go get IHSS first, to just say no. Either if the funding has got to go from IHSS, you figure it out, you make it happen, or we get to choose. It's all the same money. The IHSS is state and federal dollars. Regional center is state and federal dollars. Medi-Cal is state and federal dollars. So it really makes no sense that we have to constantly be you know, asking for and begging for services. So I don't, you know what, I'm just gonna pause, and maybe Christiana, you want to speak, because I'm gonna try to get this link over to Kavita.
So they talked about, you know, what were the themes. So everybody kind of went through their ideas of, you know, what the concerns and issues are. And we heard a lot of people talking about the how complicated it was and the siloing and all that kind of stuff. But there was one consistent theme I heard specifically from the consumers, from the parents and the self-advocates that were there, is there's too much red tape. It's just too hard to get services, and that it's just not person-centered plan. That there's so many people were talking about living in fear of losing services, of what's going to happen if my parents pass away, what's going to happen if I pass away with my children. So there was a lot of those pieces talking about the way the system is currently working is not working for the participants, and that there was a lot some cynicism of, how do we know this isn't just going to be another just discussion, high level talk about, oh, we're going to create new processes and la, 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 and nothing ever gets done. So we heard a lot of talk about, we want to know that whatever goals that are created are actually done and that there's accountability. So I heard accountability in our group a lot. People were talking a lot about, we want accountability. Elena, are you able to unmute now? We see you back. Oh, hold on. I'm looking for you in the list. See if I can unmute you.
Okay, yeah.
Oh, there you go.
Yeah, because like my phone was not liking the hotel Wi-Fi at all, and it was making everybody all glitchy. So I finally, was like, okay, I'll do the mobile app, and then my background was mirroring, and I'm like, dude. So happy to finally be back.
So Elena is on the committee. Do you want to talk a little bit about your breakout group and how it went and what you talked about?
It's honestly, just. I was going in wanting to do like concrete stuff and everything and finally like get something done. And then it was just a whole bunch of philosophical, theoretical, well, crap. I mean, like I even tried too to force like self-determination our table discussion. Everyone's like, that's nice. Like, and just they're like, oh, it's too individual because I was really like the only one at my table that knew much about it, and so I don't know, it just didn't get deemed relevant, I guess. And so it was just kind of a tiring, exhausting day because it felt like just an endless supply of ground rules and mission and values, and I'm like, what are we, a startup or a philosophy class? Like, what are we doing with this? Can we finally just get to the point and get something done? And I just didn't really connect with like hardly anybody at my table, like, anyways. Because when I got asked what made you get into self-advocacy, bad stuff happened and I want to do something about it. And it was just like, oh, it was just all awkward and everything. I don't know.
Yeah, I think one of the issues that I saw from the beginning, which I think would have resolved some of what Elena is talking about, is they should have assigned us seating. So we kind of just showed up. Like my flight, I flew out early this morning, and so I had to almost all the seats were taken, so I had to just take a seat. And I ended up sitting with a lot of people I work with every day and like-minded folks like Will Liner, Disability Rights California, Kelly Colza-Reyes, who works with DVU, Victor Lira of Aviana Healthcare, Beth Burt of the Autism Society of the Inland Empire, and I also sat with Sasha Bittner, who's a big the head of the local advisory committee at Golden Gate Regional Center. So, I mean, these are all people I know I know well, I work with, and all of our ideas were completely in sync. I mean, we were just like-minded. We're like, yeah, and we were just bouncing off of each other. I think it should have been assigned seating, honestly. And it would have been good for me to sit near some service providers and some, maybe some regional center. There's actually only 2 regional center executive directors on the master plan. The head of San Diego Regional Center and the head of East Los Angeles Regional Center. And I mean, it might have been interesting to hear what their perspectives were. And the head of ARCA, also Amy Westling, is on the master plan. So, yeah, I think, we could have solved, my little group could have solved all the problems today. We had lots of ideas. I can tell you some of the bold ideas we came up with in our group because we were also like-minded. The big one one of the big ideas is the removing the conflict of interest in service coordination or case management. So we talked a lot about the fact that the regional centers aren't trusted and what is the source of the lack of trust. And that is because the people that we work with most are the the service coordinators who are not only supposed to be our advocates, but they're also the gatekeepers to services. So, for example, you go to them and say, I'm in crisis, or my child is in crisis. What kind of supports can I get? And they're like, well, tell us about the crisis, and what makes you think you can't go get that help from your county mental health department, or what makes you think you can't go to Medi-Cal for that? And it's always like questioning everything. It's not like, let's figure out how we're going to help you. It's not like that. And so that's because case managers at regional centers are not, they're like managing us. They're not actually coordinating our services. And we believe that needs to fundamentally change. And so we talked a lot about reimagining regional centers and what does that look like. Now, I can tell you that other groups did not go there. Other groups sat and talked, like one group talked about housing and got into excruciating detail about housing, even though none of the departments that are under CalHHS or California Health and Human Services Agency, none of them deal with housing. So it's unlikely that there's going to be major progress through this master plan on housing as much as you would want to. And other groups were like, we should do a PR campaign, to talk about the importance of disability, and recognizing and respecting. It's like, that's also unlikely to come out of this. And so I think that there should have been much clearer direction on, for us. They were very broad questions. Here is exactly what we're looking for. I'm going to mention one more thing, and then I'm going to go to Makai so that she can speak. There are going to be work groups, subgroups of the master plan committee that will be both master plan committee members and community members on these subgroups. And that's where I think they're going to spend a lot of their time digging in deep on various issues, various priorities. And so I urge all of you to get on the master plan mailing list so that you're made aware of when these work groups or subgroups are going to be starting to get involved. And we'll figure out a way. I don't know if they're going to have applications, or I'm happy to try to get people's names to the project director, Victor. So, but I'm going to stop talking right now, and let's go to Mikai. Somebody could, okay, great.
Yes, thank you. Judy, I almost fell over in my chair because that is so true. I am with Regional Center of East Bay, and my case then stalled my application, self-termination. And then when I reached out to Untitled, who they have to do triage, I was referred back to my same case manager, who went about 15 minutes of our half-an-hour meeting trying to get me into other programs. Oh, what about DOR or all these things, instead of addressing my request to be in that self-termination program. I have clients here at the Independent Living Center who are homeless with developmental services, children, and everyone is jumping around the hoops trying to see who is going to help them instead of addressing or other health situations. And for all of us on this call, who may be advocates and not stop at the hurdles, there's so many others who just get defeated and stop and got care. And it just makes me crazy because, you know, these are young children who get older and high numbers of homeless individuals are those with IDG on the spectrum and don't know or haven't plugged into those lifetime services of support or not met with them. So how are we going to deal with this? And it's really a systemic, institutionalized issue. And it's just, it breaks my heart. As a mom, it makes me terrified as well. So thanks for bringing that up.
Thank you, Makai. I really agree. I mean, the story that you told about not being able to, you know, be having all these barriers of getting to the self-determination program is, to me, just a symptom of the larger issues that exist within our system. And the fact that we're not in charge of our own lives is a really big problem. Christiana, Kavita's here. So if, and made, as has been made a co-host, I don't know, Kavita, if you want to talk a little bit about what you thought of today's meeting. Can you spotlight her? And I don't know where she was. Oh, there she is. Okay, go ahead.
Hi, thank you. Sorry. I was just dealing with some housekeeping stuff. So, well, for me, actually, I had I mean, you know, I didn't come with any expectations to this particular meeting. I was just there to see what it was. And I actually got to sit at the table where Secretary Galley and Nancy Bargeman and Director Bargeman and, you know, Joyce McNair. I mean, some wonderful people. And Mark, who's the executive director of San Diego Regional Center, were. And the way our table approached it was, and Secretary Galley encouraged us to think along those lines as to what is the vision for the service system or for the life of individuals with disabilities. And everything he talked about, I know it might have some of the things that were shared were possibly, you know, ideal case scenario, but at our table, all the conversation centered around what would improve quality of life and also what would add to add value to the lives of individuals. How would we perceive the life of an individual who has a disability if the systems were improved, if there was a seamless system, you know, system or some of one door policy kind of thing where there's just one place that they need to go to, and all the different systems, IHSS, Medi-Cal, DSS, all of these, whatever services they needed were coordinated through one point of contact. And that was largely the discussion. And also, since we were talking about quality of life, our discussion also went around the fact that the larger community needs to also know how to be able to step up and be of support to our individuals with disabilities. And it was, therein came the conversation with regard to how education about developmental differences needs to be introduced to children and adults alike of all ages. Tim Jin was at our table. That was another wonderful addition. That's how the conversation also went around how there needs to be something like disability studies, which is currently just an elective in our in several educational institutions, how that needs to be ingrained right from preschool or even kindergarten. So the discussion went into belonging and how inclusion is still an afterthought, and how if everybody came together, systems would improve. And also at the same time, while we are improving systemic processes, we need to focus on the person and the individual themselves. And it was, for me, it was a very rewarding experience. I really felt this is just the first meeting, I guess. I hope that this is going to pan out and hopefully there will be action in the improvement of systems and how things are going to work a few years down the road for all of our individuals. And we did also talk largely around the fact that there's, one of the biggest fears is that what happens to our children when we pass, because I'm a parent myself. And so that is where the conversation started about community supports, and about overall educating mainstream society on this particular population, and also about having a more integrated approach. So for me, it was very nice and reaffirming. I know to hear when Secretary Galley actually spoke about it at the same time. There was a very open and back and forth discussion amongst all the team members at our table, and each of them had such valuable input to offer. So we had a special education teacher, we had two parents actually, three parents there. And there was a self-advocate, that was Tim Jin, who obviously always has, he calls people out on what is not working, and he actually shared that as well. And then you had an executive director, you had Director Bargeman, and you had Mark Galley. So from my perspective, I felt reassured that people are listening and something good is happening along the way. We even talked about a technological solution, and about tracking the different services and how it's going to be working. But we also got to know that there is something in the works with with regional centers and DDS itself, where families and individuals would, at least from the IPP perspective or their paperwork perspective, there's something that's being developed. But then the conversation went into how it needs to be larger than just the regional center system, and that people should not be kicked around from agency to agency to be able to access services. So that's pretty much, I think, what happened at our table. So
that was great, Kavita. I sometimes I become so cynical that because I've been on so many committees and at so many of these meetings, that I become cynical, and it's actually really helpful to hear somebody talk about their hopefulness. Like, honestly, I am hopeful that this process is going to lead to something good.
Mm-hmm.
If I weren't hopeful, I would be like out the door immediately. So I do have to say this, that during public comment for people who were in the room, they did it first, and this man came up, a self-advocate came up to speak, and he said that he was part of the master plan for IHSS, and then that's sitting on a shelf somewhere and it hasn't been implemented. And then there was some other master plan on another issue, I don't remember, and that's also sitting on a shelf. So obviously we do not want, this is like a lot of our time. There's going to be a lot of meetings over the next year, and I want to make sure that something good comes out of it that actually gets implemented. So I think we've got our work cut out for us. The one thing I do want to say is that the project director, Victor, of Master Plan, he seems like a really great guy, like really, really great. And Catherine Blakemore, who's a dear friend of DVUs and of the community, she wrote the self-determination law, like literally sketched it out on the back of a napkin and then made it happen. She is the subject matter expert, and helped to lead the meeting today. So I feel as if between the two of them, we're gonna be in better shape than I think we have been in previous meetings. Go ahead.
I just wanted to add, Victor was at our table too, so.
But yes, you kind of had the big wigs at your table. It was interesting.
So Judy,
Um,
there was a question that I thought kind of fits in with the conversation from Christy at 4:50 p.m. It feels like there are two separate distinct paths with traditional regional center services and self-determination. And there's a divide and honestly lack of equity for those on the traditional regional center services path as compared to self-determination. Is there a way to bridge that divide?
Excellent question, Christy. And hey, good to see you. I do feel as if sometimes we are in two different systems. I don't know, Christiana, if you agree with me, but I feel sometimes we are. My son is moving out into his own place. We hope in 2 weeks, although in the middle of the master plan, I got terrible news that there's a leak that flooded part of his house. And so I'm trying to, I know, Tim, I was kind of freaking out during the meeting, having to deal with that. But there is no possible way that my son could move out in a way that I and he would feel safe about it were it not for the self-determination program. And I know other people who've moved out, it becomes a whole thing. You have to get assessed for supported living, or you go into a group home where you're not in charge of your life. You know, we're able to hire highly qualified and extraordinary staff at salaries, at rates that are higher than in the traditional system. So we were able to get some really good people. And we're, you know, we put in our spending plan a housekeeper so that my son, you know, has a clean house all the time. I mean, there's all these cool things that we were able to put in the spending plan that could never have gone. You could never receive that in the traditional system. So Christy, I would say we are living two different worlds. Where we're living exactly the same world is in the bureaucracy. So people complain all the time in the traditional system about the hassles and all that stuff. We all complain about that too in the SDP. And so, you know, this is why DVU and the Integrated Community Collaborative are co-sponsoring a bill in the legislature to reduce some of the bureaucracy and some of the barriers in the self-determination program. Because my feeling is the more people who go into SDP, the more this whole system's going to change. Because you're sitting there and you're talking and you're like, oh, my son's moving out and he's got these great staff and he's got a housekeeper and he's got, you know, whatever. And people will stop and go, wait a second, how do I get that? And people are going to want this. And people, we all talk to each other. Self-advocates talk to each other, family members talk to each other, and we compare notes. And so that this is where it's going to remain two systems for the foreseeable future, but we are hoping that more and more people enter the self-determination program. And it'll become a bigger part of the system.
And just so everybody knows that since Judy has firsthand gone through the hiring employees process, we're going to actually do an entire SDP Connect talking about hiring employees and that process, because I know it's something that a lot of people have questions about and are talking about. So it's so great that Judy firsthand has gone through this. So we're going to walk everybody through that. The next question came from Gilbert at 4:57, and it said, how can you change that in policy or law? And I think Gilbert was talking about getting the that support assistance. So the service coordinators aren't part of the regional center anymore. They're more, you know, covering more things. So they were asking how do we change that?
You mean breaking down the silos?
I think actually you were talking specifically about having that kind of advocate person to help somebody.
Okay. Yeah, so I don't mean to interrupt. Sorry, interpreter. Okay. The separating out, the removing the conflict of interest between case managers and decision makers. So folks should know I'm not at all original. This is not my idea. This was an idea from the 1980s. In fact, I got to scan in this proposal. It was a bill. It was called Regional Center Without Walls. And it was regional. You were able to select your own service coordinator. They worked in nonprofits that are community-based. Maybe it's one that's in your neighborhood, or maybe it's one that is with a language that you speak, and that and that those people were our advocates. They helped fight for services for us, helped break down those barriers. They're kind of like what an independent facilitator should be doing. But they did not have any role in deciding which services somebody receives or doesn't receive, like what the person's budget would be in the SDP. The other role is the role of the decider, the service decider. So they through a person-centered planning process was going to really sit and look at this individual. What are the needs of their individual? And then in the SDP, they would help decide what the budget is, the needs assessment that would create your individual budget. In the traditional system, they would help decide what services there are. And that is something that would be pretty extraordinary if there was some agreement on this, if it came out of this process. I have to tell you that I raised it in our small group. The minute I said it, everyone's like, oh, that's such a good idea. But as I mentioned to you, my little small group was all my people I work really closely with that are like-minded. I'm not sure that any regional center would agree with that. So, I will continue to raise it. It would be great if other people agree. You should be raising it too. It can't just be me as one lone voice talking about the conflict of interest that exists in regional centers, to be both your case manager, your advocate, as well as your gatekeeper of services.
I raised it in the public group as well. Again, a lot of support, and really the idea of kind of like you said, like independent facilitators that are truly independent, but know all of the generic resources. So, and I think that some of the more systems vendored people there were surprised when I said, the regional center service coordinators don't do this. If they say there's a generic resource, go and get a denial and then come back. And I really think there is a disconnect from the higher ups of what service coordinators actually are doing, and that they aren't doing that. There's a lot of finger pointing, come back to us when you've got this taken care of. And so, we also talked about the idea of a advocate for the participant, for the consumer, not tied to any of the service providers, because then they become gatekeepers for those provided services. And that's where the trust issues come in. Aparna, I hope I pronounced your name correctly. Do you want to unmute? Oh, your hand went away.
Hi, yeah.
Oh, there you are.
I just wanted to say this is probably the second meeting I've attended, and I don't know what the protocol is. If we wanted to reach out to some of the speakers in attendance, what is the appropriate way to reach out? Because I just DM'd someone and then I saw the message that just came up from Kira. And so I just wanted to be mindful of how do we reach out to some of the speakers that are speaking? What's the appropriate way for those of us who are new to all of this?
You mean the speakers here at the SDP Connect, or the people on the master plan committee?
Like you, I was actually like, oh, I want to reach out to you because you're talking about what you did. And then I Googled you and you work on autism. So I'm really interested in just connecting with you. I'd love to pick your brain. So that was really, sorry to put you on the spot. I didn't mean to do that.
No worries. I'll message you my email and you're happy to reach out. I apologize to everyone in advance that I receive a gazillion emails a day, and I sometimes even my own staff, Christiana has to email me 5 times about something that is urgent. So it's like, but I'm always happy to speak to folks, and I really want to spend more of my life doing that, for sure. So I'll find your message and I will give you my email address.
Angela, would you like to unmute?
Yes, hi. I was at the meeting today and I was in the, I was part of the public, and I just want to share this. I was at the Healthy for All California's Commission, which Secretary Gailey also hosted. And I currently sit on the board of Healthy California Now. And what we did was we worked on implementing this plan, this commission, because we didn't want it to go into, go nowhere. And so what I started doing with Healthy California Now is we started making legislative visits to let legislators know about this, about this plan. That was the first step. And then it gradually evolved into SB 770, which is just passed last year. And it provides a pathway for single payer universal health care in California. So I learned a lot from that process. And I think if you want to make sure that this, and I'm committed to get this master plan implemented, those are some of the steps that you have to take. And also, finding a legislator to co-sponsor bills and things of that sort, to implement some of those, whatever recommendations come out of the report. So I just wanted to
So
chat. And good to see you again, Judy. I met you on the plane.
Angela sat next to me on a plane a few weeks ago. We sat and
Yeah.
talked the whole time. I'm
Yeah.
so excited to see you here. We got to get together.
Yeah.
Well, no, Angela, she's like a superstar. Oh my God. I'm so happy that you're here. That's awesome.
Yeah, no problem. Yeah, of course.
All right.
Of course.
See, here's an example. Angela emailed me and I have not emailed her back. I apologize to the world. My life is ridiculous right now. We'll get together soon, Angela.
Yeah, I can't wait to work with you. And I hope to go to the meeting in Los Angeles on the 15th. So
Excellent. Yes, I'm glad you said that. We should mention folks that Tim has his foot up, but hold on a second. I just want to mention that there's the 2 upcoming meetings. Hold on, I don't want to tell anybody the wrong dates. So the next master plan committee meeting is all virtual, and it is on April 24th from 1 to 3:30 p.m. Then they're doing an in-person one on May 15th in Los Angeles, in the city of Los Angeles. So for those of you who are Southern Californians, I really urge you. I think there's going to be a humongous turnout to the one in Los Angeles, just because that's where 1/3 of the state lives in Southern California. So, or in Los Angeles County alone. And I'm sure there will be lots of people from Orange County and San Diego come to it as well. Go ahead, Tim.
I had no issues of moving out on my own in the traditional system. I voiced my opinion that I was not going into a group home, and my family fully supported it. But the challenges were getting support from agencies that gave me awful people with bad pay. My goal to be an SDP was to control my life and hired people that I want and pay them a fair wage. This morning, my support staff and I were on the plane, and the flight attendant immediately noticed the bond with me and Stephen told her our working relationship and how I pay him more than any agencies. I agree with the 2 system is different, but once you get into SDP, both systems merge together, and unfortunately it's not seamless, but it works like 4,000 people who are in self-determination.
It's true. I remember you telling me stories, Tim, when you were still in the traditional system, that you would work with these agencies who had very specific times they had to finish. Like, oh, we have a shift change at 7. And so if you were out to dinner with your family, like, sorry, you got to go home, or you can't go to this rock concert, or your whatever your kind of music you listen to. He does not listen to normal music. I'm gonna say that about Tim. And so it's, you know, when we were, we could do a whole like case study on my son as he's moving out. And Tim was one of our major advisors, by the way, on this move. But the way that we're creating the staff schedule has been what works for my son, not what works for the staff. No, it's not like there's a shift change at the same time every day. There, maybe every Monday will look like every Monday, but Monday does not necessarily look like Tuesday or Wednesday. And so I'm learning so much. Honestly, I did not know what we didn't know what we were doing, because we hadn't experienced this, but we have such great teachers like Tim who understands what it means to have backup staff and all that kind of stuff. And so I mean, maybe Tim and I could do a whole thing on hiring and how we create work schedules. It is hard.
You put your staff schedule on your schedule.
Right. Exactly. I see Lisa has her hand up too. Can someone unmute Lisa?
Hi. I was there at the meeting the whole time. Luckily, I got sick today and I was able to attend. And this was a blessing that I got sick. I'm not complaining that I got sick. But what I need is that I would love to attend. I would like to go in person, but I need some direction as to what we are doing, because I could be all over the place because I get hot, right? And then I'm talking about here and there, but I don't want to be all over the place. I want to be focused on, like what you said, conflict of interest and SDP. I didn't even think about talking about SDP. I was just hot, and my head was not at the right place when they were talking about all these things, and they're not really talking about meat to the conversation. It's just like ideal. I don't need ideals, right? We need to talk about meat and move forward. Just introduce yourself and move forward with a conversation, what we're going to do differently. But I feel like we didn't even get a whole lot done in the meeting. So I was a little bit frustrated. And plus I was in the Zoom and I see all these people typing, but we can't really do anything about it. And that was like most frustrating thing. And all those people sitting in the table, there was a lot of noises and in commotions. And as I was listening to it, I did not know it was organized chaos or was it organized communication. I did not know, but I could not hear you or I could not hear anybody on the floor. That was really frustrating. I did not hear you, Judy.
Oh, wow. So even when I was speaking in the microphone, you couldn't hear us, huh, Lisa?
I didn't hear you unless I walked away. I mean, I don't know. Maybe other people heard it, but I didn't get to hear a whole lot of and then there's some problem with communication or with the speakers. People can hear, and then I don't think it was well organized. That's all I wanted to say.
These are really important pieces of feedback. I saw just recently, just now in the chat, where Maria Elena said, sounds like those meetings are not neurodiverse informed. And Elena said, definitely not as an autistic person. I have to tell you that at my table, Sasha Bittner was at my table, who has cerebral palsy and speaks very softly. And it was so much noise in the room, we could not hear her. And so we actually, our little small group left the room and went to a quieter place so that we could hear her speak. So I will definitely give this feedback to folks who work on the master plan that, just structurally, some of it didn't work. and then also sort of the people who are online. I also want to say that hybrid meetings never go well. They're always very complicated. Because the people who are watching virtually do not feel like they're part of what's happening in person. And then, like, for me, I'm hearing from Lisa, I'm hearing from Christiana and Tina what was going on in the chat or in the Q&A. I have never gotten to see that. So I have to say that I spoke to the project director, Victor, and he actually said that to me. He said, I hate hybrid meetings. I think people feel ignored. People feel like they're out of it. We should either have everything in person or everything online. And I kind of agree. Plus the interpretation, I actually just went to a meeting where our interpreters did like a training for us on how to make sure that hybrid meetings are accessible for different languages. That worked today only because there was no one in the physical room that I was in who needed Spanish interpretation. If someone had walked in that door who needed it, they wouldn't have been able to get it. They would have been across the hall in the other room with their, set up and in their own computer to listen to the Zoom interpretation, but they wouldn't have actually been in the same room. So they had no headsets and no interpreters in the main room, which is obviously problematic. Then I should tell you that during public comment, we were listening to public comment and they did not have the English interpretation on, so that when there were Spanish speakers, we were only hearing them in English. And I had to go up to the person administering it to tell them that we need to hear the English interpretation. So there were glitches for sure. Hopefully they'll learn some things from some of the glitches, but I think there's broader issues as well. So yeah, so for the next meetings, folks, we don't know exactly. I think if you get on the master plan mailing list, which we encourage you to do, Christiana has repeatedly put it in the chat, you will then get a notification with the registration link. And the same thing, they don't even know where they're having the one in Los Angeles yet. They don't even know which building they're going to use. So I really, really hope they use a very large room, because I'm expecting hundreds of people to show up to that one. Other folks making comments or any questions you all have, it can be unrelated to the master plan. If anybody has a burning question about the self-determination program, Christiana will answer it. I'm too tired.
Tracy, go ahead.
I was there as well with someone, and that meeting was crazy. It was, when they had the open room thing or whatever, you could barely hear anybody. And then it's really hard if you try to do the closed caption because it's so small to try to do that, to take notes. And it was like, yeah, there were a lot of people with a lot of grievances. It was not fun. It was not easy. It was a lot of overwhelming. It was very overwhelming, even though we had a couple breaks and a lunch. But it's just like, there need to be better. It almost seemed like it needed to be better organized with the information, how they were communicating, because when they did like I said, the open room, and it was like, you couldn't hear it. It was like almost garbled and stuff. And then, yeah, not to have an open chat. It was just a Q&A, and then people weren't answering. They never seemed to really answer the Q&A type thing. So it was just like, yeah, it was chaos and overwhelming, and hopefully the next one is better planned. I know you were there, Judy, and we heard you on that and stuff, so maybe we can get it to the right people so it's better, because like Tina said, there were a lot of people that was frustrated in the Q&A because they couldn't do the regular chat. Mm-hmm. No one was actually answering it, so who's supposed to be answering those things, or was there even supposed to be a dedicated person to be answering that? answering those questions, because they offered a Q&A area, but it really wasn't answered type thing. So
I will definitely provide that feedback, and I will also send them a recording of this meeting, so they're hearing directly from all of you about how you felt.
okay, thank you.
So Judy, I had a question which Angela made me kind of think about, as she said they finished their project and decided some of it needed to go into law and had to, what will happen as you come out with this master plan? What's the ultimate purpose of this?
Well, what we're hoping is that they will come out with an actual written plan. When I stop talking, I'm going to put the master plan, or maybe Elena, you're so quick at these things. Can you find the master plan on aging and put it into the chat, please? So that you all can see what we're aiming towards. So starting in 2019, before the pandemic hit, they started planning the master plan on aging. And ultimately what came out of it was a set of 5 bold goals, they call it. And then within each of those goals, they actually have an action plan. See, Elena's already done. And so, so that's ultimately what they're hoping to get to. I mean, the aging community has, you know, very different issues than what we have, even though certainly there is some overlap because some people who are elderly are also disabled. But you know, there was their focus, a lot of it was like aging in place and housing and a lot of those things. You know, for us, you know, we have a very specific type of system that supports us, the developmental disability system, and we have regional centers. These 21 independent nonprofits, whereas the aging community, they use basically government services. They have Medicare, they have for healthcare, and they have the county offices of aging, and they're basically accessing government systems, whereas we're accessing these independent nonprofits that are really inconsistent across the state. So I think that and they're not the only system. We have the education system, Department of Rehabilitation, and many others. So I think that this is going to actually end up being more challenging than the master plan on aging was for Secretary Galley. But I believe that a lot of us on the master plan committee and a lot of the people in the community are coming to this from the same place. And what I'm hoping is that we'll be able to get into the final master plan that's produced some pretty dramatic systems changes. That's our goal.
And if they cost money, how does that happen?
Not going to happen anytime soon. So right now, with the state of California, it's in a massive budget deficit. They're anticipating the deficit will last for another couple of years. So nothing's going to start to get implemented soon if it costs money. Of course, a lot of the changes, honestly, that we were talking about are not costly. You know, well, I guess accountability can be costly, and you know, the information technology system or the IT system is going to cost a ton of money when it's finally created. But I have Robin ask her question, and I'm going to put something in the chat about a meeting that's coming up on the 25th that I want to also tell people to go to, because I think it's going to be really critical. Go ahead, Robin.
Go ahead, Robin. Oop. You're unmuted for a second. Try again.
Well, how about that?
There you go.
Better? Okay, hi. So I have a question regarding SDP and FMS.
Mhm.
So we are a month in, and I am hoping that Christiana could tell me how or who I can contact over my FMS regarding some pretty serious troubles that we're having regarding time sheets and the budget, things I'm asking for, not getting any replies. It's just been really, really difficult. And I'm kind of at my end. I don't know where to go next.
Yes. So A couple places. One, I would say you can get the ombudsperson's office involved. Sometimes just having their email included on it helps get things unjammed. Also, your regional center, believe it or not, they are vendored through, they are courtesy vendored or vendored through your regional center. So they have to they have to answer the regional center. So you can get your service coordinator or your participant choice specialist say, my FMS isn't returning my calls. We need to, and a lot of the regional centers have contacts at the FMSs. So they can kind of act on your behalf and reach out.
Okay.
And the other thing is, just like with any other place, start working your way up the food chain of, reach out to managers. Most of the FMSs also should have a complaint system. If you look at their policies, when you sign your paperwork, they should have a policy and a complaint system. So look in there and find out, who do I contact if I'm not getting responses and things aren't moving. So
Okay.
there's 3 places to try. And
Okay. I didn't hear the first one that you said. What was that? Buzz something?
what was the first one?
Like Buzz?
Oh, the ombudsperson.
What
So
is that?
that is the hold on, I'm going to put their link in the chat.
Okay, thank
And
you.
there is a self-determination program, ombudsperson's office. So when you have problems with anything, you can, in any of areas of self-determination, you can contact the office and let them know. They're limited in what they can do to solve the problem, but like I said, sometimes just getting them involved is enough to, open up the logjam and get
Okay.
them talking.
Okay.
So,
Okay. One more other kind of, hopefully it's a quick question. So it kind of seems to me like the IFs and even the FMSs are just kind of like, one day they just decide to be this. It's I'm trying not to be rude. I really am, but it feels like that to me. Do they have to get certificates? Is there a schooling? Are they overseen? Like, it just feels really clunky right now.
Well, there's not a short answer to that.
Okay, I was afraid of
But
that.
no, I will answer it though, because it's important. So the law required that DDS put out training and certification for the independent facilitators. DDS, this came out many years ago. DDS has just now hired somebody to start doing that process. So up until this point, the only requirement for an independent facilitator was to have some sort of training in independent facilitation, but there's no standard training.
Okay.
And some of the trainings are better than other ones. Some of them are just like a, quick video you watch on YouTube. And then there's other ones that are more intensive. And then you have independent facilitators that came to the table with years and years of experience in advocacy or special education or the different areas. And then you have ones who didn't have that. And so it's not a regulated service right now. So, and it's something that DDS is aware of, the independent facilitator community themselves are aware of. So it's out there. So.
Okay.
And then for the FMSs, they also don't have good training. And they currently have a training program that is being created for the financial management services. And that's probably a year and a half out when that'll actually get done. And so I hear from a lot of the financial management services that they struggle with, that the rules aren't clear. And what we do know is that because they are vendored with different regional centers, they have contracts with different regional centers and we have 21 different regional centers that do things 21 different ways. We now have FMSs that do things their own ways in different ways. Okay. So that there isn't a standard across the board.
Okay. It's the idea is such a wonderful program, but it feels like they pulled the trigger a little too early to get started.
Well,
oh, hell no. We've been around for years.
Well, I know, but you know what I mean? Like, as just getting started, it feels like gosh, is this person really real? What are they doing with my budget? What I just feel it doesn't feel legit sometimes. So I'm not complaining because I have great people, but we do have some big troubles we're working through right now.
Well,
Thank you
good
for all
luck
your
with them. And if you get stuck, come back.
Okay.
I'm sure we
Yeah.
can come up with 3 more options for you after that.
Okay. Thank you, ladies.
You're welcome.
Robin, I'll also add that although I agreed with all of the suggestions in the exact order that Christiana gave them to you, that we know that some of these problems can only be fixed either by DDS by issuing what's called a directive, which is like changing policy and ordering FMSs or independent facilitators or whomever, or regional centers primarily, to do certain things. And the Department of Developmental Services has not done what they need to do to make this program work. So while I'd like to blame it on FMSs and I'd like to blame it on some IFs or on regional centers, ultimately this falls in the responsibility of DDS to make this program work. It is their job. And this is why we have this legislation. It's called SB 1281, Senate Bill 1281, where we're not tackling every problem, but we're hopefully tackling the biggest problems in the system. Our bill passed out of its first committee, and we are now looking for support, and maybe we'll send an email around. We're looking for support to get it out of what's called Appropriations Committee. So we'll send it around to get support, because we think one of the things it does is it defines what the employer burden rate can be for an FMS, so that FMSs aren't charging whatever they want and taking money out of people's budgets. It also protects the FMS by saying, the FMS, if something's in a spending plan and this is it, you got to pay it. Like, you don't have to keep going back and checking with the regional center all the time. So we're hoping that some of what's in this bill will actually help you and the many others that are in the SDP. All right, Oscar has his hand up. Hi, Oscar.
Hey, it's my second month of, under the self-determination program. And I just got to say, I'm very happy with, the services that are being provided and the progress that I'm making. Of course, obviously, with that comes a lot of obstacles, right? One of them, the biggest ones I've been hearing, not just here, but, throughout speaking with other self-advocates and other groups like DVU and ICC, is, the problem with the FMS and, all the financial, management behind it. Because yes, there is, in order to have these programs, money is needed. And, that's the biggest argument when it comes to these services, is the money, right? Because left, right, center, doesn't matter where you stand, the money is the biggest division here. And it's just a question how to spend it. But I was thinking, couldn't the regional centers have their own FMS district or department where, since it's coming from them, right? Well, not directly from them, but they're the ones providing the services. Couldn't they also have a department that's responsible for distributing that money to the employees working with the clients at the regional center who are under the self-determination program? Because I have, on my FMS, it was a very, very hard process to, get in contact with them. And they, took a long time responding our emails and, us sending the information needed, all the, personal information from myself, the clients that are working with me. It was just it took such a long time. And I know other people have experienced that as well. And I was thinking, well, couldn't the regional center sometime in the future, if it's even possible, have their own FMS district where they can manage the money, so that way we don't have to go to like how other people have said it, sketchy FMS programs, or, that kind of stuff. I was thinking maybe it should fall on them, so it's easier to manage, and also we get it done faster, quicker.
So let me say this, Oscar. I'm not sure I would support putting FMSs into the regional centers. You just need to have a few conversations with traditional service providers and how much money they are owed by regional centers, and how you just have to talk to a few independent facilitators who help people transition in for the first time, who get delayed a year. The payment takes a year. So in some ways, the regional centers are actually even worse than the FMSs. So I'm not sure I would support that. This is why in our legislation, what we're trying to do is to empower FMSs. The reason why these FMSs are not paying for the things in a timely way, are not calling you back, it's because they're afraid they're not going to get paid back by the regional centers. And the reason they're afraid is because they haven't. They have actual experience. I can tell you that like maybe 2 years ago, GT Independence, which was the largest, it still is, represents the most clients in the state of California, they were owed $1 million just by San Diego Regional Center. Just by one regional center, they were owed $1 million. So you can imagine they are now very nervous about spending money on behalf of one of their clients if they don't think that they're going to get paid back by the regional center. So that's where I know somebody called their FMS a mini regional center because they feel like they're going through all this bureaucracy with their FMS. And that's because that's exactly what they have become. And so we have to make sure that we empower FMSs, but we also have real guidelines on what they're allowed to do for us and what they're allowed to charge us. So one thing I can tell you about our legislation is that Christiana and I recently met with 2 different FMSs about the legislation and walked them through it. I was a little nervous. The FMSs would hate the bill, and they loved it. These 2 FMSs really loved it. So that's certainly our goal, is to walk through all of the bill with all the FMSs and to get their sign off on it. And what I'm hoping that means is that that this bill will move forward and become law.
And I hope so too. I mean, I think that we all can agree here on that. We can get this bill on the floor and get it, working. I can't stress how important it is for us to, keep on pressuring, keep on, fighting, because, the moment we go silent, it's just, it's going to get worse. So I'd say, I appreciate what you guys are doing and what organizations like you guys, what you guys are doing here. And I'm excited, looking forward to tomorrow. Can't wait to be there as well. It's just, we got to keep fighting. We got to keep fighting.
Oscar is coming to Sacramento, meeting us in Sacramento tomorrow to fight for this bill. So we're excited to see you. We'll see you tomorrow, Oscar.
All right. We'll see you guys tomorrow.
So we had a question in the chat that said, Maria Elena at 551 said, is there a group of young adult self-advocates who teach other young adult participants how to be self-advocates? That's a great question. I'm not certain about the young adult self-advocates, but I'll tell you that Disability Voices United has the Self-Advocates Speakers Bureau, which helps teach self-advocates how to go out and become speakers. And it's such a great process to learn the art of doing this. And there is an art to doing it, of having yourself organized and having your speech ready and those pieces. And so I highly recommend, we just finished the current round. We will be doing another round. Is it next year, Judy?
Yes. And so Tim Jin, who you heard speak earlier, Tim is the head of our Self-Advocate Speakers Bureau. But we're going to be doing lots more of this stuff. I was actually, I don't know, Marilena, where you live, but I was at the master plan while we're taking a break. I was actually speaking to a woman who's running a program that sounds exactly like what you're talking about. It is young self-advocates between the ages of 16 and 26, maybe, who are teaching other self-advocates about their legal rights and about how to advocate for themselves and what, and so I don't know where you live, but they're looking for 75 young people to join this project. She was asking me to promote it. So I'll have her send us some information. And if you're on our mailing list, you'll get that. But I think it's only in LA. Oh, it's for your son. I see. And you were in Los Angeles. Fabulous. So I will connect you with this for sure.
Aparna, go ahead.
This is actually going back earlier, so I want to be very mindful. So I actually was diagnosed as being autistic just 3 or 4 years ago. So I went my entire life not knowing. And what that did was actually, I was finally excited, like, oh my God, I have an answer, right? Like, why has everything been hard and difficult? And one of the things that I got really frustrated by was the lack of resources and support. Because you hear all about all this like autism awareness and rah, great, but then you actually go and find services and they're non-existent. And so I want to preface that by saying that's really what drove me to become a provider. So I got my private fiduciary license in California and I served veterans. I did pro bono for Social Security. And then I now trying to become a vendor with Regional Center. And so to the question of what kind of support, like I really took it very seriously to say, I'm going to make sure that I know how to pay bills. I'm like licensed. I've been doing it. So I've been working with Department of Veterans Affairs. And then when it comes down to the Regional Center, it is so challenging to work with them. I was literally approved by the Department of Veterans Affairs. I'm still trying to figure out the Regional Center vendorization process, number one. Number two, reading the contract, they're like, we're not liable for anything. And I was like, how can you not be liable? How am I supposed to rely on information that your team provides me and then take the risk? Like I'm literally sitting there going, that doesn't make any sense. So just as a provider, they don't make it easy. I just want to say, and then even when I've literally gone back and I said, hey, what are the guidelines for being a provider? Because I'm trying to be the FMS bill payer because that's in my wheelhouse, right? I've been doing this, I know this. They have no guidelines. Like when do you need EBV? They don't tell you any of that. Like when do you need a W-9? Like for example, why would I need a W-9 if I'm a bill payer? Because I'm hiring from an agency, right? You don't, technically you shouldn't need that. When do you need to review agencies? When do you need to review background check? Well, technically, if you're a bill payer, you shouldn't need to, right? Because you're not an employer of home. They don't explain any of that. So that's the thing that you guys don't realize. They won't even, and I've literally gone and I'm waiting for my regional center liaison to call me back. And I went to DPS to go, hey, you guys, I don't have this. I even went to the State Council on Developmental Disabilities. There's someone I know there who is a part of the ombudsman office for SDP. I'm like, where's the information? Because I need to know what my role and responsibility and scope is. There's none of that. And so that's why you get these really big companies because they have a ton of money and lawyers. So if anything goes wrong, they can handle it. But for the rest of us who are coming in going, hey, I want to be better because I know what it's like to get not great service and have that lived experience. They don't make it easy. They really make it hard. So to all the small providers out there, I just want to say, to everyone who's struggling, everyone's trying. Like really, you would not believe the rates that they were offering. And that's really why it took me so long, because as much as California champions, oh, we're going to pay fast food employees $20. Fun fact, a lot of the rates that they actually pay regional vendors are from 2016. Yeah. Like it makes no sense. So I just want to get that perspective.
I'm so sorry to interrupt because we're coming upon 6 p.m. I urge you, Aparna, and I urge everyone else to come to our upcoming next SDP Connect, where we're featuring some new FMS providers that have entered California and they are, some of them are really small. So you might learn a little bit about it. Before we leave, can I just call on Rosie Laska? If you could ask her to unmute her hand is up. She's my friend that I was just mentioning is doing this self-advocacy training in Los Angeles. So for that person. Rosie, are you able to unmute?
Yeah, I'm just trying to see if I could get my video going too. Okay, there I go. Can you guys hear me?
Yes.
Okay. Hi, I just got back home from where we were, Judy, at the master plan. So yeah, real quick, we are offering self-advocacy training for individuals between the age of 16 and 22. It is in the LA County. It's just about understanding their voice, how to express their feelings, their needs, their wants. So it's very basic, the beginning stages of learning how to be a self-advocate. It's a course, they get certified, it's a few videos that they have to watch, and then we'll be doing workshops in LA and we'll provide the details on those locations later. So I'm looking for 75 participants. I put my contact information there, but I'm on my phone, so I don't have my computer. So email me there. Next week, I'll post the flyers.
Thanks, Rosie. Appreciate it.
Thank you, Judy.
How great is it? Somebody says, I'm looking for this, and we have it right there.
So
Okay.
as Judy said, our next Connect is going to be on April 24th, and it is introducing 4 new FMSs. They're not all of them are new, but they're new to California. So please come and meet them. They'll be very excited to meet you. We have to get going to be because we are so thankful for our interpreters. Thank you all so much for interpreting for us today. We really appreciate you, and we hope to see all of you at our next Connect. Thank you.